Hello everyone and welcome to AceOSCE's video for today. My name is Alicia and thank you so much for joining me again. Today in this video I just want to give you guys a little bit of a heads up about the different sections that we have in the CTC, which is the Compendium of Therapeutic Choices. So in my previous video I went through the CPS, which is like a big book which has the entire monographs, but today I just want to give you a little brief introduction about one specific section which is ultra important in your CTC. Now, most of you who are preparing for your evaluating exam and some of you who have started your preparation for the MCQ already know this book and know how to maneuver through this. But I wanted to give a little bit of information for those people who are going to be starting reading through this. Out of the whole book, I don't have the time today in this video to go through each section, but one of the most important sections in this book is about pregnancy and breastfeeding. So every time you read about a topic, in the end of the chapter, there's a little section about pregnancy and breastfeeding, which is quite important, and I'll show you why. Let's have a look at what it shows. So in terms of choices in pregnancy, this is one of the last topics that is covered under the ASMs or anti-seizure medications. A lot of times when you get questions, even in your OSCE stations, you have to ask the patient, especially if she's female, of childbearing age, if she's pregnant or breastfeeding, just because, as most of you know, our medication choices will change with the answer of the patient. Where to look for that information for your own knowledge, and just in case you get this reference as your OSCE station reference, or maybe even a question in your MCQ. So this is the section where you're going to go in and maneuver through, so you know which drugs should be and which drugs should not be given during pregnancy and breastfeeding. A lot of times the sections may be a little bit vague. They may leave the decision upon the doctor, so the doctor has to assess the patient, outweigh the benefits of the risks. But again, that is something that will be a referral case, so you have to know when to refer and when to exactly stop something. So if you see this reference right here, it does say that over 90% of patients with epilepsy treated with ASMs have successful pregnancies and outcomes. So that means that we probably don't want to stop the medication right away. Different medications have different effects of teratogenesis and different levels, if at all, for pregnant patients, which is going to be written down over here. One of the main points is the last point in the paragraph, which specifies that do not switch ASMs during pregnancy to avoid teratogenesis. The risk of major congenital malformations is highest in the first trimester, before many patients have discovered that they are pregnant. A change of ASM therapy during pregnancy exposes the fetus to risks associated with polytherapy and exposes the patient to the risks of serious adverse reactions and uncontrolled seizure and/or status epilepticus. So here is a quick thing that I got an answer for one of my students today. So just an FYI for people, this is where you want to look all your drug choices in pregnancy and do not switch ASMs when you're pregnant unless the doctor says so. I hope this quick video helped you guys out as to where you can find answers for patients who are pregnant or breastfeeding in drug choices. I come across this very often in my pharmacy practice. A lot of patients who come to me come for recommendations because when they're pregnant or when they're breastfeeding. So this is where you want to look the answers at for. If it's confusing, always ask the pharmacist or your manager, and if you don't know the answer, as always, refer to the doctor before putting the patient at risk. I just wanted to reiterate, guys, that I'm doing my PEBC OSCE classes for the next session. That is, I think, in November now. So do definitely DM me in case you'd like to join our classes so we can go through some OSCE cases together. I can show you other references, tips, and tricks to make you feel better and your performance improved. Let me know in case you guys have any questions or concerns, and I'd love to help. AceOSCE's Facebook page is right there for you as well. Definitely go through that. I share regular questions for your improvement in your PEBC exams. See you in the next one.